McKesson UK strives to be the UK's #1 healthcare provider. They have a number of household names in the UK under their belt, such as Lloyds Pharmacy, John Bell and Croydon, AAH and Lloyds Pharmacy Clinical Home Care. And that means that we can provide an end-to-end healthcare offering from manufacturing and wholesaling to actual dispensing and administration of medicines, dispensing around 150 million prescription items across the UK each year. Yeah, so pharmacy in the UK is facing a number of challenges, and we recognise that in order to adapt and change to those challenges, we needed to change our systems. The NHS released a long-term plan January of 2019, and in that they stated they wanted to break down the barriers between our community primary care offering and our hospital secondary care offering. And at the moment, we're not in the best position to do that with our current systems because they lack the ability to perform and operate with other platforms across the NHS. The selection process itself was quite lengthy. It took over 2 years to come to that decision. We went out to market. 6 companies tendered to replace our existing system. We evaluated them, and that evaluation process consisted of demonstrations, site visits, so we got to see the system perform in a live environment. And LS Retail completely blew everything on the UK market and out of the water. It was clear from the outset that LS Pharmacy would be the product that could meet the needs of our business going forward. We want to be able to reflect the changing behaviours of our customers. They want to be able to access applications on their smart devices. They want to be able to have a strong online presence for us. They don't necessarily want to access our services by walking into a pharmacy anymore, although that's still very important. So with LS Pharmacy, we had the option for our patients to potentially use those applications out of the box without really us having to integrate to multiple systems. One of the things I particularly loved about it is that we can have our patients book appointments for their administration of medicines in the pharmacy, lock down the trained resource and come in at a time that's convenient for them, and also order their regular repeat medications and pick it up at the same time so it's convenient for that patient. The fact that you can integrate to perhaps mental health applications so that they can report how they're feeling so that we can better support the management of their conditions, for instance. It's a complete game changer in healthcare for the UK, and it will help McKesson UK. It will enable us to deliver a far better patient outcome for our customers. Yeah, so historically pharmacists in the UK have been hidden slightly from their patients, but there is a real drive from the NHS and from us as a business to bring that pharmacist to the fore of the shop, to provide their expert knowledge to those customers face to face. Because LS can be used on tablet devices, we can now bring our pharmacists to the front of the store and actually provide that consultation face to face at the front of the store, so that our patients get a better experience from it. Another example of mobile technology is the LS Stock Application Management app, which is another plus for us. Our historic system had real issues keeping an accurate stock file. With this, you can have it on a handheld device and you can go around scanning your stock, updating it as you go and reordering it so that we can support a full F&R and have the right stock at the right time and a full accurate record of it so that we can supply our customers with the things that they need instead of having to give them the bad news that actually it's out of stock and we can't find it. So at the moment we maintain all of our master data in-house. It's quite a lengthy process in terms of our existing systems, and we can't keep up to date as we'd wish. With LS Pharmacy, we'll be able to still use the UK standardised Dictionary of Medicines and Devices hierarchy, which we have to use for the NHS, but have a full up-to-date stock record in there and an up-to-date product range in there, so that our data and reporting on those items will be more accurate. One of the issues that we have, because we are so far behind, is actually claiming the money we're owed from the NHS accurately, because our product file is not up to date. So by having that data in the system, not only can we sort out the problems we might have with stock, but also in reimbursing items from the NHS, we'll actually be able to give them accurate information and be paid accurately in return for those services. The NHS, from what we've showed them already, are delighted with the product. They're very excited about the possibilities that we as McKesson can bring to the UK market by using the LS Pharmacy platform. With LS Retail and the LS Pharmacy platform, we'll be able to provide our patients with a truly omni-channel patient experience. We can put them at the centre of their own healthcare, so that they can access information via the Lloyds Pharmacy application provided by LS Retail. They can book appointments for a time that suits them for patient services, such as administration of IV medication. They can track and trace where their prescription is at any point and know exactly when they can pick it up at their own convenience or have it delivered at home. In addition to that, they can access other applications through that software and record information that we can then put on that patient's record that helps our clinicians support them in the treatment of their conditions. They can then share that information with their consultants or their GPs at hospital or at their local doctor's surgery. So therefore, their entire healthcare is wrapped around them and they feel like they're in control of their own health.